Good morning, or maybe good afternoon. Now we're going to be looking at the second half of the axial skeleton, the vertebral column and the thoracic cage. So you're going to need to know, again, the parts and features of these particular bones of the vertebrae, the three basic types, and be able to recognize if it is a cervical, thoracic, and lumbar vertebrae. We'll talk briefly about the differences in size. And so here is part of the list here. Remember to always use your guide at the beginning of the unit of the list of things to know to study from. I also want you to know how many of each type of vertebrae there are. We have 7 cervical vertebrae, and these are going to be, let me pick a color here, these red ones here, all right? And then in this section here, we have 12 thoracic. Look at the differences, and it's harder to see in this, but you can still see, look at how small and light the cervical vertebrae are. And then here in this section, you can see they're getting larger. Look how thicker the body is. It carries more weight. And then here's the lumbar region. We have 5 lumbar vertebrae, and those are the biggest and the heaviest, all right? So there is a really good way to remember how many there are of each type, and that is going to be breakfast is at 7, lunch is at 12, and dinner is at 5. All right, so that's one way you can remember those, okay? Breakfast is at 7, so they are 7 cervical vertebrae because they are first. Lunch is in the middle, lunch is at 12, and we have 12 thoracic vertebrae. Dinner is at 5, and we have 5 lumbar or the lowest vertebrae. Then we have the sacrum here, which is 5 fused vertebrae, and the cossacks, which is also known as our tailbone. Here are the 3 basic types of vertebrae, and we go into some details on these during the lecture as well. Cervical, you can see here, is very small and light. They are also bifid, meaning they have a forked, spinuous process, and that is going to be this middle process here on the vertebrae. And we do have a couple of exceptions to differences in cervical vertebrae, such as the atlas and the axis, which are the first 2, and we're going to look at those in a moment. All right, but you can see the body of the cervical vertebrae is very small. The bones in general are lighter and thinner and not near as heavy in general for their whole structure. Then we also have here, the next we have the thoracic, and it is intermediate in weight and density and how heavy it is. And then lumbar, bearing the most weight, is going to be the largest. So if I was to put a picture of these on your exam, you would need to be able to tell me which type they are, okay? And so look at these differences also here. This, you have a very broad angle. If you have a high angle there, these are much more straight, okay? And these are what we call transverse processes because they are transverse. They are on the side. And the first one, you don't see those near as well. They're very, very tiny, all right? And of course, we have some foramen here, which allow spinal nerves to go, the spinal column to go through, and then some other nerves to go in and out, and blood vessels as well. All right, so this is a typical vertebrae. So these are the features that vertebrae generally have in common, and we're going to look at these and identify these. We have the body here. Then we have the transverse process, which remember I said is transverse, is going to be on the side. The superior articular facet, and this, remember, in articulation is where you're going to have some movement, and this is kind of a concave indentation there, and so you're going to have another bone that articulates there. We also have the inferior articular facet, okay? Inferior, articular facet. We don't see that one in this picture here. The spinuous process, which is right here, that is going to be what you actually, when you bend over and you see, this is what you typically see sticking out, okay? And then we have the lamina and the pedicle. So the lamina is this section here, And this picture really has the best drawing. I tried to draw these circles out, but it wasn't very good. So lamina here, and then we also have the pedicle here. And we're going to look at these briefly individually. Oh, by the way, so you probably have already figured out the way these worksheets work is you're going to have a number here, and that is how you are going to label it on the worksheet. So here are some transverse process here. These serve, we are transverse process and body. Transverse processes serve as points of attachment for muscles, and this is really very important because they've got to have a way to attach and hold on to things. And then the body, remember the body of any bone is always the main portion. So the transverse process, remember they are going to be transverse, they're going to be to the side. Much of this lecture is going to be just pointing these features out. All right, so here now we can see we have the inferior articular process and the superior. So I want you to notice when you are looking at these, it can be really hard to orient which way these goes. And I'm going to make you a little video and show you in APR how to use their 3D rotational model. And I really encourage you to examine things from all perspectives. But you also want to stop and look and give yourself kind of a perspective on where you're at. Okay, so this is pointing this way. Okay, it's pointing downward. You have these here sticking out. And so I want you to pay attention to these small details so that when you are looking, you can tell which side of the vertebrae you are looking at. And that is really important for you to see and understand. So let me ask you to stop and think. Which is the anterior surface of this vertebrae and which is the posterior surface? All right, so if you look and you can kind of see here in this picture, the spinuous process points downward, all right? It points downward, okay? And because this says superior, it must be on the superior portion, okay, on the top portion. And I think I might have said anterior, but so this is going to be the top of the vertebrae, and this is going to be the bottom of the vertebrae here, all right? And so you need to, anytime you are looking at a bone, stop and think, what perspective are you looking at it from? Because if not, it gets really hard to identify things. So you have to pay attention to the small things. And this is another reason why drawing is so important, because when you draw it, then you get a better idea of how it actually is basically put together. And then I would even draw it from different perspectives, because this picture here looks different than this one, all right? And so that's the spinuous process there as well. Remember, this is what you can actually see that comes out on the spine, or that you feel when you go down the side of your spine. So here we're looking at the lamina and pedicle. I didn't have drawings on here, and you can see this is showing you both sides here as this is moving, all right? And so the pedicles are this portion here, and the lamina are these portions here. Here we have C1 and C2, the atlas and the axis, all right? And so the way I keep these straight is which one is which is the axis has this little portion on it here called the dens that actually serves as a point of rotation for the atlas. So it's actually the center axis, and the atlas will actually kind of be able to rotate on that. So these are C1 and C2, atlas and axis, and they're pretty distinctive, and you do need to be able to identify these just by looking at them. And you can see they are very different than the rest of the vertebrae. All right, so now we are looking at the sacrum, okay? So we have the sacrum. We're going to look at the sacral promontory, the sacral hiatus, and the tubercle of the median sacral crest. There are lots of other portions on the sacrum, but we are just going to focus on these. And so here you can see the sacrum highlighted. So we're looking at the anterior surface of the sacrum here, and you want to be sure and orient yourself as to whether you are looking at the anterior or the posterior surface. And the places you want to look are right up here. And of course, this is the sacral promontory. And then also down here, there's no opening. And on the other side, when we look at the posterior surface, you're going to see that there is an opening. All right, so you can see that opening here on the bottom, and we call this opening the sacral hiatus. You can also see that the top here looks a little bit different on the posterior surface. And then you can see we have these tubercles here. And these are median or in the middle of the sacrum. And so this is the tubercle of the median sacral crest. And so this whole uprising area here would be a crest. And so we're looking at those individual tubercles. So here we're looking at the cossacks, which is basically what we call our tailbone, okay? And so it's at the bottom here of the sacrum. You can kind of see it here from a lateral aspect as well. It's right there. So next we're going to look at the sternum. You can see it here highlighted in green. And we're going to look at some features of the sternum as well. The jugular notch, manubrium, body, xiphoid process. That should say process right there because it is a process, and then the clavicular notch. So this upper portion here, this is the manubrium, and then of course the main part of any bone is the body. On the manubrium you will find the clavicular notches. There's one on each side, and this is of course where the clavicle will interact with this manubrium here. And then we also have the scapular notch, the jugular notch, which is right here, this portion here, all right? And then on the very bottom, you have the xiphoid process. Now, I want you to think, why is it important that we know where the xiphoid process is? All right, so if you said because of CPR, you are correct. So this is one of the reasons why you measured with your 2 fingers to know where to put your hands to do CPR correctly, because this can sometimes be broken during CPR. Of course, it's much better to break this and save someone's life, but if you can avoid breaking it, that's even better. So now we're looking at the ribs. We have the true ribs, which are ribs 1 through 7, and then we have the false ribs, which are ribs 8 through 10, and then we have the floating ribs, which are 11 through 12. They're differentiated by the way they attach to the manubrium, okay? And so 1 through 7 is the true. 8 and 9 and 10 are attached with much more of the costal cartilage, and then the floating ribs 11 and 12 are not attached by any cartilage. So ribs number 1 through 7 are the vertebrosternal ribs, otherwise known as the true ribs. You do need to remember that those are 1 through 7 and how they attach. Then we have the vertebrochondral ribs, and those are named because they attach to that costal cartilage. Chondral refers to that, and these are ribs 8 through 10, and we call these false ribs. If I ask you on the exam, I'm not usually looking for the number of the rib. I want to know, is it a true rib, a false rib, or a floating rib? Lastly, we have the floating ribs, which are the vertebral ribs, and these are 11 and 12, and of course you can see here they are not attached by cartilage there. We also have many parts of the rib, and these are the parts we are going to learn. We're going to look at the head or the vertebral extremity, because this is where they adjoin. Then we have the neck of the rib, which we know is always below the head. And then we have what we call the costal groove, the shaft, and the tubercle. So we're going to look at all of those. So here we've got the head, or which is also called sometimes the vertebral extremity, like I said, because of where it joins. And then we have the neck, which is always below the head. And I want you to notice we have some little tubercles here on this side, and so that's how you can tell which end is which when you're looking at a rib. And it's kind of hard to see in this picture here, but if you look very closely, there is a raised line, and I don't want to draw over it. There's a raised line that you can feel and see much better in person, but that is the costal groove. If you look at some of the drawings, like if you search for Gray's Anatomy, which is online, which has some pencil and paper drawings, you can see that costal groove in those drawings very well. Next, we have the shaft, which is the portion here between the ends. All right, and then here we have a little bump that's on this side right here. You can see it over here as well, and that is the tubercle, So this is the last slide for this section. You can see here where the vertebral extremity is, or the head that adjoins the vertebrae, and of course the sternal extremity are where they join or near the sternum.